Hey there, Dr. Devin Coglin here with Freedom Chiropractic, and just want to talk to you today about disc herniations. This is something we see on a regular basis in our office, and so if you're suffering with any type of back pain, especially if it radiates down your legs, if you have problems with numbness or tingling in your legs or feet, or you have pain in your lower back that radiates into your buttocks, that is often signs of disc herniations or disc bulges. So I just want to take a couple minutes to explain to you what's going on in that case. And a disc herniation is simply, it's something here. I'm going to show you a little anatomy so you get a better idea as far as what we're talking about. But this picture, you can see we're looking at the right side of the picture here is representing a lower spine there. It's showing L3, L4, L5 vertebrae, and then also the sacrum and tailbone. All right, so you're going to see there's three discs there. And the disc in the middle, which would represent the L4, L5 disc, you're going to see that big red spot there. And that red spot is representing a disc herniation. It's red and inflamed. And you can see it's pinching back into the nerve there. That's a side view. If you also see there's a top view, and it's showing a disc herniation where that outer ring of the disc is torn. And then the inner part there is the soft jelly part of the disc. And that's actually called the nucleus pulposus. And that part, when that outer ring rips, that inner part leaks out into the spinal canal and it's pushing on the nerve. And that creates that pain in the back that also radiates down the legs. All right, so here's just another view where we're looking at a herniated disc. Again, we're looking at, if you look at the left side of the picture there, you're going to see that's typical or normal. The outer ring of the disc looks healthy. The inner part is healthy as well. And then if you look at that right side of the picture there, you'll see that's a herniated disc. You can see that outer layer is torn and that inner layer has begun leaking into the spinal canal. Again, you can see that red spot in between the discs. Again, another example of a herniated disc. And then we're going to show that what that looks like on an MRI. All right, here on this picture, this is an MRI of a lower back or lumbar spine. And again, you're going to see the two red circles there that are indicating where the disc herniations are. This is a side view looking at someone's spine. And if you look at the upper part there, you'll see that the discs look very normal. They stay within the boundaries of the bones. And then if you look at the bottom two discs there, you can see that that part of the disc pushes back into the spinal cord and the spinal canal. So that would be an L4, L5 disc herniation as well as an L5, S1 disc herniation. Here we have a picture of an MRI of a cervical spine or of a neck. And again, they're also a very common area that we'll see disc bulges or disc herniations. And again, in this case, you can see that part that's circled in red. There's a big disc herniation pushing back into the spinal canal. So a little bit different than a lower back disc problem. A neck or a cervical disc herniation is going to cause numbness or tingling into the arms or the hands. It can cause weakness into the arms. It can cause radiating pain into the shoulders. So again, someone that has a disc bulge in their neck or a disc herniation, they're going to have neck pain. And again, it's going to go into the shoulder, sometimes down the shoulder blade, into the arm, into the hand. Again, can cause numbness, tingling, or weakness. All right, so here we are. Let's talk about some solutions. And I'm excited to go over this with you. This is what makes our office, Freedom Chiropractic, unique and distinct, is that we actually have a very specific disc protocol where a lot of times, you've been told before that either there's nothing you can do for a disc or you can take steroids for a disc or possibly have a epidural shot in your neck or your back, like a steroid shot to help calm down some of the symptoms you're having from the disc. But we have a very unique protocol. We call it our Freedom Protocol. And so that's going to consist of four main things. First and foremost, you're going to see there's chiropractic adjustments there. The reason that's important is because when you have a bulging disc or a herniated disc, that doesn't happen typically right away. Typically, there's some sort of biomechanical issue that's been going on for some time. There are cases where they do happen immediately, like in a bad car crash or a bad sports injury, a bad collision. You could have a disc herniation happen just like that. But a lot of times it's happening over time. And so chiropractic adjustments help to address bad spinal biomechanics. So if your joints in your spine are not working properly, we refer to that as a subluxation or subluxation complex, meaning that the joints in your spine are not working properly. So the chiropractic adjustments actually help to restore normal motion to your spine so that your discs have basically the normal position of everything that's happening there. If you get abnormal motion or bad biomechanics, it puts extra stress and strain on your discs. All right, so that's first and foremost. Secondly, we have something in our office called decompression therapy. Decompression has been around for a long time, and basically what it is it's a way to decompress the spine and the discs. Okay, so if you picture a water balloon, and if you were to compress a water balloon like that, it would be pushed out to the sides. All right, and so if you take the pressure off of a water balloon, you would actually help to decrease how it goes out to the sides. It's the same thing when we talk about a disc. Here I'm showing you a spinal unit, and that disc is that red space in between. If I compress the disc like this, you can see that disc will herniate or push out to the side like that. And if I take pressure off of there, you'll see that reduces back in. So more pressure on a spine is going to make the disc go out to the sides. And if you decompress a spine, that disc will work its way back to the center where it needs to be. We also utilize something called soft wave TRT, and that stands for tissue regeneration technology. So we actually have one of the few offices in the entire country that offers this therapy. And soft wave is actually a sound wave that will do three things. Number one, it's going to decrease the inflammation in the area. So when a disc is herniated or bulged, it's inflamed, it's swollen, and it's irritating the nerves around there. And so soft wave will help decrease that inflammation. Secondly, it's also going to increase the blood supply to the area. So when you have a disc herniation, like I said, that outer layer of that disc tears and there's damage there. And so if we can send new blood flow to the area, it can increase repairing that. Okay, so again, we're going to decrease inflammation. We're going to increase the blood flow to the area, and we're also going to mobilize our body's own stem cells. So this is really cool because, again, you've heard of stem cell therapies. That's going to be, typically your traditional stem cell therapy is they're going to be getting stem cells from another person and or some controversial ways that they'll get them. And then they inject it into you. This is a much safer option, a much more conservative option that your body's going to mobilize its own stem cells, send them to a damaged area to help that healing process. So again, soft wave is crucial for that. It's also going to help decrease future flare-ups of disc problems. And then lastly, you'll see it says individualized rehab. That could be stretches. That could also be strengthening exercises. Now, what we've learned over the years with disc herniations and disc bulges is that not everyone responds the same way to different rehab therapies. All right. So again, if we talk about certain exercises or certain stretches, it depends on the disc injury of what you need to do to help restore yourself back to being healthy again. So what works for one person doesn't work for the next person. And so we have to be individualized and make sure that that's prescribed, that you can be doing on a regular basis. What's cool about that too is that a lot of people that have a disc problem can have future flare-ups. And so doing your stretches and strengthening exercises will minimize and prevent future flare-ups. So this protocol we've been using for a number of years now. We continue to get better at everything we're doing as we learn more and we get more clinical knowledge. But again, we are the only office that offers this freedom protocol that we're going to be implementing all four of these different strategies to help you get the best result. At the end of the day, it's got to be individualized for you so you get the best results as possible.